The information given during this audio interview, and which is on the website that you are viewing during the BHRT World Summit, is not intended to replace a one-on-one relationship with a qualified healthcare professional, and is not intended as medical advice. It is intended as a sharing of knowledge and information from the research and experience of the practitioners in the field. I encourage you to partner with your own qualified healthcare provider to make the appropriate decisions for your individual best health. This is the BHRT World Summit. Bioidentical hormones have been practiced by licensed medical physicians throughout the world for more than 4 decades. There is plenty of medical research which is the basis for this practice. What everyone should realize is that in medical school, we are first taught about how a healthy body functions. These normal pathways are studied intensely, and then for the most part are then forgotten as we become besieged with illnesses and diseases that affect all of these normal processes. We are then taught a course in pharmacology, that is, what chemicals can control the illnesses. Except for some infections, we are not taught how to cure the illnesses, just to keep them in check. Once a person has diabetes, high blood pressure, high cholesterol, depression, and so on, they always will have it. A new way of looking at illness is to see the person out of balance. Learn what exactly is out of balance. What are the basic building blocks to health that we all had and need to return to be at our peak health? Identify where the imbalance is and help the body to return to its original state of health. Then the person continues his or her life in good health. Not only does it sound good and reasonable, it actually has been working for decades. Our hormonal system is one of the very basic systems that needs to be in balance for us to be healthy. Testing the hormones and finding what is missing, and then giving the body back the actual identical hormones that for one reason or another have become deficient, along with nutritional supplementation specific to the hormone imbalance, and lifestyle changes, has been successfully returning illness to health and health to long and productive lives without medications and even without the need for continuous hormones. Our successes are patients that don't need our services. Today we are fortunate to hear about one of the most important glands of the body which affects so much of our health. It is not very famous, but believe me, after 21 years of medical practice, I can say that the adrenal glands are probably the most abused gland of the body and causes the most damage, but conventional medicine pays very little attention to them. I hope that you enjoy this presentation and take to heart what it teaches you to acquire the highest. Eldred Taylor, MD, is a board-certified obstetrician gynecologist and is an assistant clinical professor at Emory University. He is considered a pioneer and expert in bioidentical hormone replacement. He lectures nationally and internationally on the use of saliva testing and the bioidentical hormone replacement treatment. Dr. Taylor is a cutting-edge leader in medical education, and he has provided over 200 hours of CME to physicians nationally and internationally. He has his own live webcast, he has his own website, he has his own practice, and he spends a lot of time going around the country teaching doctors what we should have all learned in medical school. Thanks, Dr. Taylor, for being with us.
Thank you so much for having me. I'm very excited to be here.
That's good, because we're excited to hear you. Today we're talking about the adrenal gland. Can you tell us, where are these adrenal glands located?
The adrenal glands are right above the renal glands, and the renal glands are the kidneys. So that's how they got the name adrenal. They're adherent or above the kidney. And they're small little glands, but they really pack a punch. They really almost influence every other system in your body.
What are the main systems that they do influence?
When I say every system, I mean every system. The adrenal gland makes adrenaline. Adrenaline is what happens when you are under stress. Usually your body looks at stress. Instinctively, your body looks at stress as go to the survival mode, that my life is in danger, and it has to decide whether to run away from this danger or to fight this danger, and so it really is an animalistic instinct. And so to that end, it has to make several changes in order to be able to run or to fight. So it increases the cardiovascular system, it makes your pulse race, it makes your heart pound faster, it puts glucose into the bloodstream, it takes blood away from the gut because it takes a lot of energy for you to break down food, so it takes blood away from the gut. It makes the brain more alert initially. It sends blood to the muscles so that you're able to run and you're able to fight. It dampens the immune system when you have long-term stress. It decreases the pain sensation. So it sets up everything for you to be able to survive right now, and it turns off everything that is involved in long-term survival because that will consume energy. And that includes disrupting hormone function, immune system function, thyroid function. So it's really this emergency alarm system that is only thinking about the present moment.
It sounds like that system is perfect if we're in a war or if we're running away from a lion or some major thing. Are we exposed to that high adrenaline in our normal civilized life nowadays?
Well, you sure are, because the only response the adrenal gland knows to stress is that fight or flight type response. So you're exactly right. It is initially, that response was initially created to help you survive a jungle, or we were hunter-gatherers to make sure that the saber-toothed tiger wasn't going to eat us. You're right, it works well in a war. It works well if you're being chased by a robber. It makes perfect sense in any one of those situations. But the problem is that the perception of stress is in the eye of the beholder. So now in our normal, what we call normal civilized existence that we have, the stress that we have now is the job that we're worried about being laid off of because our mortgage is going through the roof and our equity is going down. Stress is, I've got a ailing parent who has Alzheimer's, and none of my other brothers and sisters will step up to the plate and take care of them, so I'm going to have to bring them into my house with my other 3 kids and my husband who's gone all the time. And it's the stress of the kids who aren't behaving and aren't doing well in school, and friends that betrayed you at deaths. And then also some of the stresses are environmental, the toxins that we breathe in and that we cause a stress to our liver. Even though we don't perceive it as a stress, it is a stress. So there's all these huge array of different stressors that aren't life-threatening, but the adrenal gland can't make that distinction, so it turns the alarm on, and now the alarm is on stuck. It doesn't turn off because you're always exposed to worries or these environmental factors or these emotional factors or these physical factors. Let's say that you are having an operation for whatever. That's a physical stress on top of the emotional stress and on top of the environmental stress that is constantly bringing that alarm.
So you're saying that the same reaction that we would have if we have to run away from a robber or something as extreme as that, we actually are experiencing in our bodies in our regular workday because our eye is taking it in as if it was a major threat to us.
Exactly. If you get laid off of that job, it is a stress to your survival. Now, you don't need to fight anybody. You don't need to run anywhere, but it's a stress. You're worried about your financial future. You're worried about the financial future of your family. That's a stress. My mother is coming to live with me. What is that going to do to my family? Is my husband going to be okay? Are my children going to be okay? Is my parent going to be okay? Are they going to die while I'm here? Well, I'm close to all of those things, you get the exact same response. And we all know that. If you're worried about a layoff coming up, what happens? Your pulse increases. Your heart starts beating in your chest. You start getting palpitations. Your stomach gets squeezed. You start to have diarrhea. That's the exact same thing that would happen if a robber burst through your door. Increasing the pulse, increasing the blood pressure. Your stomach would get queasy. The problem is it has become so constant and so routine, we feel like that all the time. What do patients come in complaining of? Anxiety, irritable bowel. We give it names, but what it really is, it is a result of constant chronic stress.
Can you tell us what's the cycle? A person starts off with a lot of stress. What does their adrenal do? And if they have stress for a long time, does their adrenal step up to the plate forever? What happens in the course of stress in our lives?
Here's what happens. Initially, the alarm is going off. We step up to the plate. We handle that stress. We run. We fight. We do whatever. But if that stress, let's say the layoff has been threatened for 2 or 3 years, and over that 2 to 3 years, you get a divorce. Your children, one of your children runs off and joins some radical group or whatever. Your mother dies. Something else happens. Well, with all of that stress going on, at a point, your adrenal gland reaches a point where it cannot continue that high output. So what happens is that you have a normal daily rhythm of cortisol, where normally, even if you're not under stress, in the morning, your adrenaline should be high. You wake up, you're ready to go. And at night, what should happen is the adrenaline should go down so you can calm down and go to sleep. Well, when you're constantly on that alarm where the normal daily rhythm is twice what it should be, the adrenal gland over a certain amount of time, and some people it might be 3 months, some people it may take 2 years or 3 years. But after a while, the adrenal gland is unable to keep up that pace. And instead of going back to normal, what will happen, it will create kind of a flat line. I'd say that the adrenal gland is rationing out adrenaline. So it gives you the same amount in the morning as it does at night. And it's about halfway between that curve. So what patients will come in complaining of after they've been under stress for a long time is that they'll say, I'm just not like I used to be. What happens is that in the morning I can barely get myself out of bed. And the crazy thing about it, Doc, is that at night I can't go to sleep. And so they're really in this awful predicament where they're tired all day, but at night when they need to go to sleep, they can't sleep. And so that lack of sleep just makes them more tired in the morning. So if you don't intervene, if the doctor doesn't understand that and doesn't intervene appropriately, the adrenal gland continues to lose its ability to make even that abnormal amount of adrenaline or cortisol. Finally, you get into this chronic fatigue where you're just tired all day. Again, because the alarm is still trying to go off, but nobody's responding, patients will tell you that they're tired, but they're still anxious. They know that alarm is going off, but they have no energy to respond even to the normal daily routine. And so that is what we call chronic fatigue, but it really lies in the fact that their adrenal gland is totally non-functional.
I see that a lot in my practice. We call it wired but tired. They want to go to sleep, but they just can't.
Right. And during the day, when they want to have some energy, it's just not there. The problem is that right now, most docs, what they see is they get that same history, but they don't tie it into a previous stress, and so they assume that the patient is depressed, and so they hand the patient an antidepressant. And that antidepressant is only covering up the problem. The true problem is in the adrenal gland, and that if we understood how to measure adrenal gland function and how to correct it, then we would see these patients improve, and they wouldn't need to be on antidepressants for the rest of their lives.
In some of the popular books, it talks about this cortisol, the hormone that we measure from the adrenal gland, relating to if a person is overweight. Can you tell me how is cortisol related to weight? Somebody getting fat in the belly, or people want to lose weight. How do they get there, and how do they get out of it?
Here's what happens. If you are under stress, the body says, don't store away any glucose. We need glucose in the bloodstream. So what happens is glucose goes in the bloodstream. It turns off something called growth hormone that would help distribute the glucose properly. It sets up insulin resistance because insulin would put glucose into the cell. You don't want to do that when you're under stress. You want it in the bloodstream so it can go to the muscles so that it can use it for energy. Now, what happens is that because the muscles aren't using it for energy, eventually, long term, it has to get stored somewhere. And so the great place that cortisol likes to store it is around the belly. What happens is not only does it use the glucose that should have gone to the muscle that wasn't used, not only does it store it there, but also start to break down proteins or start to break down muscle. They'll try and use that as glucose But then when it never gets used because you never run a fight, it eventually gets stored, and it gets stored around the belly. What you'll see in these people with abnormal cortisols or abnormal adrenal gland function is that they'll have big bellies and their muscles will have wasted away because you've had this high cortisol level for so long. It's broken down everything, trying to make sure that you have plenty of glucose, because eventually it thinks you're going to run or you're going to fight. And then finally it just says, okay, we're just going to store it away because sooner or later you're going to have to fight off this predator. So you end up with these people with poor muscle mass and a lot of fat mass. So now what happens after this has all happened, then with this chronic stress, you get to the point where you start to have more and more fatigue. And so now even the normal amount of energy that you would expend, you don't expend that because you don't have any adrenaline. And so what does that do? Now your activity is decreased, so that's just going to make you fatter. If you don't fix the cortisol so that it can take away some of that fat and kind of use it for some energy, fix the adrenal glands so that you can start to have some normal activity, you are just in this vicious cycle. You got this big fat, you don't have the energy to burn it off. You could have permanent insulin resistance so that your cells are constantly not taking the glucose into the muscle, they just continually just store it away. Again, that is something that we call metabolic syndrome, which will eventually lead to diabetes. But when you really look at it, one of the initiators of this could be chronic stress, and it's probably an initiator more often than we know.
So what you're telling me is that part of this cycle, the beginning part, a person makes too much adrenaline, too much cortisol. If the doctor can see it being elevated, he can help that person lower that cortisol. And if he is at the other end of the spectrum, he's already been under stress for a long time, his adrenal glands are burnt out, they can't make any more, he's overweight, and the doctor finds him with a low cortisol, he has a whole different set of treatments to help him get out of it.
You're exactly right. If cortisol is too high, you want to decrease cortisol output. What happens is you would normally be able to regulate your cortisol, but what you do is you override the normal control mechanism, which is in your hypothalamus pituitary. I know I don't want to get too technical, but you can override it. You have the ability to override that normal control. When you override it for so long, it just becomes desensitized. It says, okay, if you want high cortisol, okay, you have it. I'll just stop trying to regulate it. You can use phosphorylated serine, which is just an amino acid, which is totally safe, and it'll resensitize your brain so that it can lower cortisol output. If the cortisol is high, you use that simple amino acid to help your body regulate it again. If you're at the other end of the spectrum where your cortisol is wiped out, you can use cortisol for the short term to try and increase that adrenaline function. And also you use adaptogens, which are botanicals or herbals that have been used for thousands of years. Chinese and Asians and Rim-type countries have used adaptogens for 2,000-3,000 years to help cope with stress. You can use those and it will help repair the adrenal gland along with some vitamins like B vitamins and vitamin C. You can actually restore adrenal function. In the United States, where I live, conventional medicine doesn't look much at trying to restore function. We're primarily focused on providing drugs that will suppress symptoms. But when you're suppressing symptoms, you have to continue that medication. If we can understand how the adrenal gland works and how to repair it, we can repair it, and then the patient is not going to need to continue with any type of drugs or even any type of supplements. You may want to take some supplements just to maintain that function, but if you repair the gland, there's no need for this constant symptom suppression of taking medicine until the day you die.
When you were telling me right now about the treatment for an underactive or a burnt-out adrenal gland, you said you can give them adaptogens, and you also said you can give them some cortisol.
Yes.
That's the same as hydrocortisone?
Yeah, right. That's hydrocortisone. The same hydrocortisone that you would rub on a rash or something, which is an anti-inflammatory. That's the same thing that you would use. Cortisol is a great anti-inflammatory. It helps to modulate the immune system. And when cortisol is very high, you're going to have problems with the immune system. It may manifest itself in allergies. It can manifest itself in susceptibility to infection. We all have anecdotally known that, hey, when people are under stress, they seem to get colds more often. They seem to get sick. It may be associated with even the expression of cancer. We've noticed that a lot of cancers seem to happen 2 to 3 years or diagnosed 2 to 3 years after a major stress. Cortisol, when it's too high, suppresses the immune system. Cortisol, when it's too low, causes the immune system to not work properly. But cortisol in the proper manner actually enhances immunity. That's why you put it on your rashes, because you want the immune system to be able to handle it appropriately. Yeah, we're talking about the same hydrocortisone.
So a doctor who finds his patient with a low adrenal function, which most of my patients have, probably from chronic stress, would have prescribed for them hydrocortisone. Patient asks, I hear that hydrocortisone's got that word in it, cortisone. And cortisone, I know, makes people fat, and doctors get their patients off of it as quick as they can. And you want to give me this hydrocortisone until I start feeling stronger, which could be 3 months, 6 months, or maybe even a year. Aren't you doing me damage by giving me this hydrocortisone stuff?
What they're getting it confused with, I have the same problem when I mention this to docs. What they're getting confused with is prednisone. Prednisone, no doubt about it, if most of the patients have friends or relatives, or maybe even themselves, if they have a friend with lupus, asthma, any type of autoimmune disease, they have friends on prednisone, and when they're on prednisone, they get this moon-based buffalo hump. But prednisone is 4 times as potent as hydrocortisone. So if I give 40 milligrams of prednisone, which is the usual dose when you're trying to suppress the immune system, if cortisol is too high, it suppresses the immune system, and if it's too low. If you have an autoimmune disease, which means you have where your immune system is attacking you, you want to suppress it. And that's what happens with lupus and rheumatoid arthritis. So you want to suppress the immune system. So you give this super high dose. And one of the problems with the super high dose is that you get fat because the glucose going into the bloodstream, you get insulin resistance, just like we talked about, and you get swelling, you get edema, because you're on this huge dose of 40 milligrams of prednisone, which is equal to 160 milligrams of cortisol. When we're treating patients with cortisol, we're usually using no more than about 20 to 25 milligrams over the course of the whole day. So when you're thinking about 160 milligrams of cortisol is equivalent to 40 milligrams of prednisone, we're only giving 20 milligrams. That is a minuscule dose. And as long as I'm bringing a low cortisol to normal, I'm not going to get any of those immunosuppressive side effects. I'm not going to get the glucose going in the bloodstream. I'm not going to get the insulin resistance. When you bring a hormone from low to normal, you're not going to get the side effects that you would if you bring it from low or normal to super high, 4 times normal.
Everybody wants to know what's natural and what's not natural. Is cortisol and hydrocortisone natural in the body, and is prednisone and cortisone natural in the body? Where is the natural stuff, and where is the stuff that's made outside that can cause those side effects?
Prednisone is not natural. Hydrocortisone is broken down to cortisol in the body. Cortisol is identical to what the body makes. That is the body's stress hormone. Cortisol comes from the adrenal gland along with adrenaline, and they're like kissing partners. You know, they're bosom buddies. They usually go to the same place. So the adrenaline is making you excited, and the cortisol is getting everything in motion. It's cutting off certain things, making sure there's enough glucose, breaking down protein, is doing all of that. The adrenaline is primarily working on the cardiovascular system to pump up your heart rate. It's going to the brain to get you excited and to get your brain to work faster. Cortisol is just like what the body makes. You can take it as hydrocortisone, and your body breaks it down to cortisol. Prednisone is not found in the body. That's why you get so few side effects. Now, I'll be perfectly honest with you. If you give a huge dose of cortisone, not a physiologic dose, you will get some of the same side effects. And that's the same way with the other hormones that other people will be discussing. I don't care whether it's estrogen, progesterone, testosterone, cortisol, thyroid, whether it is natural or not natural. If you're going to use a natural hormone, you have to use it in the proper amount and restore normal physiologic levels and not give it at supra or sub-physiologic levels.
Let me try to summarize so far before we go on. The adrenal glands are sitting on top of the kidneys. They're small little glands, and they're important in the energy that the person has, his immune function, and also some hormone production. It happens that these adrenal glands sound like that they ought to be called the stress gland, because when there's a lot of stress, they're going to produce, and sometimes they overproduce, and sometimes they get stuck in overproduction, and if they're stressed too much, they're going to wear themselves out. It affects us the way we feel, the way we look. It can make us vulnerable to illnesses and cancers. It's a very important gland that we don't hear too much about. Doctors don't test it too much, and even though it seems like it's the basis of so many illnesses that we have.
You're exactly right. I'm a physician gynecologist, and I first got into this whole subject matter looking at testing for estrogen and progesterone and trying to balance that. And after about 2 years into it, I knew I was missing something. I heard a lecture about the adrenal gland and really got enamored with it and just engrossed myself. The adrenal gland is much more important, I'm a physician gynecologist, is much more important than the whole controversy on estrogen and progesterone. Because what I'll tell you is that hot flashes and PMS and irregular bleeding, those are all nuisance, but the cortisol and adrenal function, people die from abnormal adrenal function. It makes you more susceptible to cancer. People die of that. There are actual statistics that say 75 to 90% of all visits to primary care physicians are for stress-related complaints or disorders. Almost 100% of the patients who walk in a primary care doctor's door, there's some association with their ailment with stress. When I lecture the doctor, I said if 75 to 90% of your patients had diabetes, you would go to all the conferences, you'd read all the books about diabetes. If 75 to 90% of your patients had hypertension, you'd go to every conference about hypertension, you'd read all the books, you'd know everything about hypertension. But 75 to 90% of all visits to any doctor, there's some component of stress involved, and doctors don't even know anything about the stress reaction. That is something that we've got to do a better job of understanding. It influences everything. It influences how much estrogen, progesterone you have. Again, it influences thyroid. So I appreciate this opportunity as another to stress the importance of how doctors and patients need to understand how important this gland is.
You started to talk about it, but maybe we can go into more detail about how the adrenal function, because nothing happens in the body in a vacuum, there's all this feedback and interaction. What's the interaction between the adrenal gland and the thyroid, the adrenal gland and the sex hormones? What combinations do we see? Does one cause the other one to work better or not work better?
I'll start with the sex hormones since how it got started in it and how I knew I was missing something, because if you're under stress, the body is not necessarily concerned, and you got to think, the body thinks stress is a life or death situation right here and now. If the body thinks you're in a life and death situation right now, it is not that concerned about reproduction and balance in hormones. Because if you don't get out of that life-threatening situation right now, there's not going to be any reproduction to be had. Your body turns off that whole hormone system. You can have a person who is in great health, normal periods, no problems. Let a stress happen. Let their parent die suddenly or their husband die. They will get disruption in their menstrual cycle. They'll get irregular bleeding. They'll get all kinds of problems. What about fertility? I dealt with a lot of infertility patients. There are statistics to show that going through an infertility workup, which is very stressful, having to have sex on a certain day, taking all these medications, going to get ultrasounds, that fertility goes down when you're going through an infertility workup because of how stressful it is. Fertility goes up when they give up on the fertility workup, and their fertility goes up after they're done and they've given up on it. We've all seen people who have adopted children, and so now the stress of not having a child goes away and they get pregnant. Your body says if it's a life or death situation, if you're under stress, the last thing you want to do is get pregnant, so it turns off ovulation. It causes the hormones to not be in synchrony, because why should I be bothered with that if I could die any moment? Well, let's look at the thyroid gland. The thyroid is concerned with long-term metabolism. You have thyroid hormone, it affects every cell. If I want to focus on certain sites like the muscles, make sure you have enough energy in the muscles, then I want to run off of adrenaline. I want my adrenal gland to take over, cut off thyroid function, because thyroid is indiscriminate. It's going to make all the cells use energy and to go through all their processes. So it suppresses thyroid hormone, and that's another reason why you gain weight. Here's the other weird thing. When it suppresses thyroid function, it not only suppresses thyroid function, but it suppresses something called TSH. And TSH is how most doctors determine whether the thyroid gland works. If your thyroid gland is not working, TSH is supposed to go up to tell you the thyroid's not working. When the adrenal gland is working overtime or undertime, it doesn't matter. If it's taken over, it suppresses that TSH. So even though the thyroid is not working, if I do the routine test, it won't show me that. And so I used to see patients all the time who would say, I feel like I have a thyroid problem, and I have all of these symptoms. I'm gaining weight, I'm not eating much, and I'm constipated. My hair is falling out, my hair is dry. All of the low thyroid symptoms, and we would do that TSH, and it wouldn't be elevated, so we thought that there was no problem. But the problem was that the abnormal cortisol, which most docs don't understand how to test or what it does, was suppressing thyroid function, but it wouldn't show up in the normal thyroid test. So those are just two examples of how stress just turns off what it needs to turn off so that it can rule. So I'll tell patients and tell doctors that stress rules all. When stress is involved, everything else takes the back seat, and it doesn't care. It doesn't care if it's not working normally or not. And if you perceive that stress for 5 years or 10 years or whatever, stress still controls everything. So your hormones can be out of balance for that long. Your thyroid cannot be working. Your immune system is not working. Your gut is not working. You're not absorbing proper nutrients. Your cardiovascular system is getting overworked. Your brain, what happens in the brain is that with all this excitability, all this alarm going off, there's another system called the parasympathetic system. And what it does is it's supposed to calm you down. It's supposed to evaluate the situation and says, oh, don't worry about it. Things are okay. It's just your job. It's just your mother. There's no life or death situation. Well, there's two neurotransmitters, what you call it, called serotonin and dopamine, that helps to calm you down and to make you feel happy and not to worry. When the alarm has been going on for so long, you can run out of serotonin and dopamine. One way you can increase your serotonin is by eating carbohydrates, and that's why we call those type of carbohydrate, sugar, sweets, or comfort foods, because they help you to feel better by increasing serotonin. Depressants, what they do is they make your low serotonin last longer. If your low serotonin is made to last longer by a drug, if you stop taking the drug, your low serotonin is going to surface again. So you're going to feel bad if you don't take the drug. Well, if you don't want to be addicted to sweets, or you don't want to take the antidepressants, the other thing to do is to try and increase your serotonin by taking amino acids, and this one is called tryptophan, 5-HTP, and tyrosine, which you can get in a shake. You can do all this, and so you increase your serotonin, and now it blunts that alarm reaction, so you're not so anxious and nervous. You feel better about yourself. You're not grabbing the cravings for the carbohydrates go away. So stress controls what you eat. Stress controls how you absorb the food. Stress controls your hormones. Stress controls your thyroid. And so I'm not over-exaggerating when I tell you that stress, cortisol, and that little gland above your kidneys affects every system in your body.
I don't know if people understand what you just told them, but you just told them the answer to life and to death.
And you know, that's why I'm so adamant. I mean, I have really moved on from progesterone and estrogen, because you can give estrogen and progesterone all day long. Adrenal gland is not working properly. You're going to get them some better, but they're not going to get back to normal until you understand if their adrenal gland is functioning properly and see what all the collateral damage has been.
Some of my patients are disappointed when I do a test on them and find out that their estrogen and progesterone are normal and they're still having hot flashes at nighttime. And then I say, well, look at your adrenal gland. They're so worn out and tired, they expect that they're going to leave the office with a prescription for estrogen and progesterone, and instead they're getting some hydrocortisone and some pregnenolone and some adaptogens.
Right.
And unbelievably, I get a phone call a few days later, another week later, my hot flashes went away. I said, what do you mean they went away? You didn't take any estrogen or progesterone.
And that's right. And, you know, I mean, I learned that the hard way. And that's why I told you is that I'm an OBGYN, so I'm supposed to know about these hormones. That's all I'm supposed to know about. Because in America, we're taught compartmentalized medicine. I'm responsible for the ovaries, and that's it. The ovaries and the uterus, I don't want to know anything else. That's how I looked at it. Okay, I'll learn about estrogen and progesterone. But I knew I was missing something because I had those patients who, just like you said, you were giving them estrogen and progesterone, they were still having problems. But then when I understood the adrenal gland and you fix that, and then it allows everything to work appropriately. It's so important for the patients to understand, because the patients have a part in this too, is that if you do get that abnormal cortisol, you have to let the patient reevaluate their life. Because 3 ways that you can help your adrenal gland or decrease the stress is that, one, if you can, eliminate the stress. If it is a job that you hate, get another job. If it is food that you're allergic to, so you're stressed, eliminate the food. People are gluten sensitive, and that constant stimulation to your immune system because you're allergic to something can be causing a problem with the adrenal gland. So try to eliminate the stress if you can figure out what that stress is and you can eliminate it. The second thing is change how you respond to the stress. If your kids are irritating you, you have to change the way you respond to them. You have to think of some other way. If your mother-in-law is getting on your nerves, then you got to figure out a way to not let her push your buttons. And then the third way is to help your body through the stress. Sometimes there are some stresses that you cannot eliminate. You have a sick child. You have a mother, and you're the only child, and you're responsible, and there's no one else who can take that responsibility. If you cannot eliminate the stress, if you can't change how you respond to the stress, then you have to help your body through the stress with the adaptogens, with the vitamins, with the pregnenolone, with everything that you said. But sometimes you have to do a combination of all 3. Eliminate stress, change how you respond to some stressors, and then help your body to recover and to maintain your ability to absorb other stress.
That's probably the most important part of our job, since we're not using these strong chemicals and giving antidepressants and making people like zombies. We're trying to get them to, like you said, reevaluate their life and how they deal with stress. Coming to that red light doesn't have to bring fast heartbeats, and even if you're a few minutes late, for whatever reason, it's your decision how you're going to view life. If you're going to be calm and relaxed, or you're going to push the button to the elevator 4 times to get that door to close, because...
You're exactly right. That's why I said stress is in the eye of the beholder. I often give the example is that if I'm at the amusement park and I see a huge roller coaster, it is stress for me. It means my heart races, my stomach gets queasy, I get palpitations, I get dizzy, all types of things. When my son sees it, he's exhilarated. He's saying, oh, this is going to be so much fun. He doesn't get a queasy stomach. He doesn't get palpitations because I'm scared of roller coasters. He's not. And like you said, whether you you push that button 4 times or whether you just sit there quietly and listen to the elevator music and relax, it's just funny how stress is all in the perception. You just think a boxer gets in the ring and that's his job. He doesn't get the same adrenaline rush as I would if I thought I was going to get my head beaten in. So it just is under the patient's control how they're going to perceive their situation.
And I just wanted to reemphasize one last point, and that is that the whole idea of this treatment, of giving the bioidentical hormones, whether we're calling them the hydrocortisone and pregnenolone in the adrenal field, and the vitamins and the herbs and all the minerals and whatever we're using, it's all for the purpose to help the person get better and let the person continue on in a healthy way. They're not stuck on these things all their lives as soon as they fix the stresses that have gotten them in this situation.
Exactly, and that's the key. We're just trying to restore balance in the physiology. Now, the patient has to restore balance in their environment. They're going to have to avoid the foods, avoid the situations, all this stuff. What we're trying to do is to get you back to where you started from, because I believe that most illness is not doesn't just magically appear. Now there are some, but a lot of illnesses have their initiation in what we have done to it by eating wrong, worrying too much, not taking care of it, not giving it proper nutrition, and all of these things. So we're trying to give the patients the advice and the tools to get them back to where they started from, and to kind of let them understand how they got to that point, and hopefully they will make the necessary changes in their lifestyle and diet and exercise so that they can maintain, now that we've got them reset, that they can maintain that normalcy without much of our help at all.
Right. Now, Dr. Taylor, since I have you here and I'm so happy to be able to speak to you, could you explain to us the different kind of testing that we would want to do to find out what our hormone levels are, and which one you prefer and why?
Tell you is that when I was in residency, we never measured hormones in the blood, and I really didn't understand why, but we just never measured them in the blood because clinically they didn't tell us much. If you tested estrogen on a premenopausal woman, it was always normal. If you tested on a postmenopausal woman, it was always low. But if you gave the postmenopausal woman estrogen, some would do fine with it, some wouldn't. If you gave it to them, you couldn't go back and retest the blood and see if the level was appropriate. And I just never understood it, but I just accepted it because that's what I was told, and that's what we did. We just gave the same thing to everybody. Now I understand is all hormones are made from cholesterol, which is a fat. And that's a whole other subject, but that's why cholesterol is not evil, and you don't need to have a zero cholesterol. If you look at the commercials, you would think that cholesterol is poison from hell, but that's how you make hormones, and it has other use. Cortisol is a fat, so it's fat-soluble. Fat-soluble hormones, in order to stay in the water-soluble blood, it has to be surrounded by this protein. And how I give the example is that in order to deliver fat-soluble hormones, you have to put it in a FedEx truck. And I guess everybody in the world knows what FedEx is. The FedEx truck delivers hormones to the tissue. As long as the hormone is in the FedEx truck, it really is inactive. It can't do anything. It has to be delivered out of the FedEx truck and brought into the tissue, which is fat-soluble. You have to look at that as long as I am looking at the number of trucks, it's not really telling me anything. What I have to do is I have to go to somebody's house and say, how many packages did you get delivered? Because the packages are what really pack the punch. They're the ones that affect the cells in the tissue. Now, if you're measuring hormones in the blood, all you're doing is measuring the number of FedEx trucks. And you have to understand is that I could have 10 FedEx trucks going around the neighborhood, but the only thing that's important is how many packages do they deliver. So 10 trucks could deliver 3 packages to the house, or it could deliver no packages to the house, or it could deliver 15 packages to the house, all from those same trucks. I have to be able to knock on somebody's door and say, hey, how many packages did you get? And I would assume that if they say, hey, I got too many packages today, or I got too little, or I got the right amount, that probably everybody else got their right amount, or too many, or too little. So one of the doors that you can knock on is the salivary gland door. The saliva will tell me how many packages got delivered to the salivary gland. If I know how many packages got delivered to the salivary gland, and I know what's normal, I can assume that if the normal amount went to the salivary gland, the normal amount went to the uterus and the brain and the ovaries and the breasts and all of that stuff. So I look at the saliva because it tells me how many packages were delivered and how many packages are still there in the house. Now I can tell how the hormones are affecting the tissue, because really the blood is just a transit system. It only delivers packages from one place to the other. The action goes on in the tissue. If I can understand what is the activity in the tissue, then now I understand what that hormone is really doing. That's how you test for fat-soluble hormones. Fatty-type hormones that come from cholesterol is you knock on the saliva gland door. The great thing about knocking on the saliva gland door is that you can knock at any time. I don't have to draw blood. I don't have to have somebody special that's skilled at drawing blood, so I can draw it at any time of the day. And we said that cortisol has a daily rhythm. It should be high in the morning and low at night. So I can knock on the door. I can get you to do a sample at home in the morning. I can get you to do it at lunch. I can get you to do it in the afternoon and at midnight. And now I know what your daily rhythm is. If we were trying to do that in the blood, one, we wouldn't be able to get an accurate amount. And also, we wouldn't be able to bring you to the office 4 times a day, especially at midnight, when I'd have to hire somebody to take your blood at midnight, and then it still would only be measuring trucks. It would not be measuring the number of packages delivered. If you look at the number of packages, you're going to be able to correlate with that, with how the patient feels. If you're just looking at trucks, you're going to be fooled more times than not.
That's a great way to understand it. What you're saying is that when you do a blood test, we're getting an inaccurate number of our hormone levels, not something that we can rely on. If we would get a tissue level of those hormones, we would know what's really working inside of our body, but we can't stick a biopsy needle inside your leg or something to find out what your hormones are. But saliva is made from the tissues. It's a byproduct, and it has hormones in it. So you could just put a little saliva in a tube. The laboratory could read how many hormones you have in it, and that would correlate with what your tissues were, and you wouldn't have to get a needle in your leg to check that out.
It's really a beautiful thing. I'm turning on the saliva faucet. It is a byproduct of that tissue, and labs have already figured out what the normal amount that should be derived from that tissue. You just extrapolate from there and say, okay, if there's a normal amount here, there's probably a normal amount in other places. That's what we do with all biopsies. You take a little sample and you assume that whatever the concentration is there, that's the concentration in the rest of that tissue. That's the great thing. It's so easily accessible. Patients can do it at home. It doesn't take a lot. It doesn't take any special equipment, just a small little valve. Patients can collect it. When they're done, they can send it to the lab. When we talk about that interplay between one hormone and the other, we can take a wide sampling of different hormones. We can look at thyroid, we can look at estrogen, progesterone, BHRT, the cortisol, and now we can balance. We can look at those levels, and we can balance all of those. We have all this information, so we see all the collateral damage, we see everything, and then when we restore balance to all of those, it's amazing how much better the patient can feel.
What about the criticism that some people will say that if you're doing these tests on one day of the menstrual cycle or one day of a man's life, it doesn't correlate with the rest of the month or the rest of the week even? Everything is always changing. So how can you come to any conclusions?
If you understand hormones, you can allow for this. In a premenopausal woman, you're right. Her hormones change in a predictable pattern, in a supposedly predictable pattern at different times of the month. The 2 weeks before the period, you should primarily be making progesterone. The 2 weeks prior to that, you should primarily be making estrogen. So estrogen and progesterone have a monthly rhythm. Well, if you understand that, you can test at the appropriate time. And with a premenopausal woman, you want to test about a week before that period, about day 21. So you understand what the normal pattern is. You know what the ratio should be during that time. You can test for that. Now, also, one of the labs has a month-long test where every 3 days they would give a sample. And so we can map out her monthly pattern, and if that's abnormal, we can try and correct it. We understand that the menstrual cycle is a month-long pattern. I just told you that cortisol is a daily pattern. That daily pattern does not change that much unless you have some real emergency on that day. That daily pattern is set. That's why when you go to the West Coast, I'm on the East Coast, if I go out to the West Coast, it's 3 hours earlier, I will still wake up at 4 o'clock in the morning because I wake up at 7 o'clock here. My daily pattern is already set. I'm going to get that surge of adrenaline at 7 o'clock Eastern time no matter where I am. It doesn't change that much. Thyroid hormone, it doesn't really have a daily pattern, so you can look at that at any time. The monthly pattern of the menstrual cycle has a predictable normal pattern. The daily pattern of cortisol is predictable, and thyroid does not really have a pattern. So you need to understand what is normal, and you compare normal to whatever the patient is to see if they're following those known patterns.
Is this saliva testing that you're talking about, is it something new? Did it come out last week? Is it done by one little company? Lots of doctors never went to medical school hearing anything about saliva testing, and nobody knocks on their door and tells them about it. So, of course, it means that it doesn't exist, or it's just some sort of fad. Are there regulatory boards that show that this is accurate? Has it been around for a while? Do they use it in research?
Saliva testing was first done back in 1959, so it's older than I am. A lot of studies were done in the early to mid-'80s, and it showed that it did reflect the free, bioavailable, or the active form of the hormone, that you could rely on this testing. Most of the saliva labs started in the 80s. The lab that I use, diagnostics, started, I think, back in the mid-'80s, so they've been around for over 20 years. Saliva testing, I'm not going to tell you all labs are the same. There are regulatory boards. There's COLA, which is an accrediting agency that accredits diagnostics labs. And then also CAP, which is the College of American Pathologists. Diagnostics is accredited by that also. So there are regulatory boards. Medicare, government, they pay for salivary testing. Salivary testing is used by the U.S. military. Cortisol testing is to test for fatigue in their bomber fighters so that they can know when they're fatigued or they're battle weary. NASA is presently using salivary testing for prepare for a manned mission for Mars. They have the astronauts in these extreme conditions of cold and heat so that they will be able to handle the extreme temperatures on Mars. And they're using salivary cortisol testing in order to determine what effect it has on them concerning stress in their adrenal gland with being under these conditions for a long period of time. The lab that they're using is diagnostics, the one that we'll talk about with the COLA accreditation and the CAP accreditation. So this is not something fly by night. It's not something that happened last week. U.S. military, NASA, Medicare, U.S. government. Again, you're exactly right. When doctors haven't heard about something, they think that it's irrelevant, but it's just that there's nobody knocking on their door telling them about it, but there's good information about salivary testing.
I was happily surprised when I read that lots of medical research done in the hormone field to check if this hormone does this or that is done on saliva because it's more reliable than blood. That told me where they have the precise measurements and they're coming to these conclusions that the whole world is taking to the next step and it's helping us develop our ideas, our theories, our medicines, our treatments, and they're basing their answers on saliva hormones. That told me that they know the numbers and that's what the mode that they use to check. That's got to be something that we can apply to our patients.
They're looking at numbers to be more precise than what we actually need to treat our patients clinically. So if that's the most precise measure, I can do it fairly economically for the patient. Tests are cheaper than blood tests. Why wouldn't you offer it to the patient? You can offer a better test at a better price that's going to give you better information to make your patient feel better. The only controversy is that doctors are not aware of it, but there's no negatives to this.
Thank you, Dr. Eldred Taylor, for being with us. You actually gave us the secrets to life, and I hope that people will listen to this recording over and over again until they totally understand the things that you told us, because being in the field and working with the patients, both of us see the same patterns over and over again, and how we're vulnerable to illnesses, and the knowledge that we are in that position is worth its weight in gold if we just pay attention to it and we make a change, so that we can leave that standing in the middle of a traffic and stand on the side. That's what it's all about, and I know that it gives you great pleasure and fulfillment to help somebody out of the middle of all of that traffic that's coming at them speeding, to be able to put them on the side and say, you know what, you were heading for cancer, you were heading for bad arthritis, you were heading for lupus. Look at this profile, and now not only do you feel better, but I feel better because the labs are a lot better also.
Yeah, doctors are at a point where they're frustrated when they have so many patients that they feel like they can't help them. They do the routine test and everything is normal, and the doctor just doesn't know what to do. So I feel the same way you do. Finally, I have a tool that is going to help me help more people, and I'm not just sitting there scratching my head trying to figure out what's going on with the patient.
Okay. Thank you again, Dr. Taylor.
Okay. All right. You're welcome. Thank you so much.
Dr. Eldred Taylor is a recognized expert in the field of bioidentical hormones. What you just heard about stress, the adrenal glands, and saliva testing is a result of years of experiences in the office with patients and in the books of medicine and its research. Not only does it make sense, it is also the reality. I have two requests for you. Not only do I feel fortunate to bring these medical facts to the public, I feel that each of us listening has the responsibility to help educate others. I request you to tell other people to listen to these interviews. As you heard today, if a person actually follows up with the recommendations of hormone testing and treatment with the bioidentical hormones and a holistic approach, you can change your medical direction from heading for a crash to heading for a long and healthful and productive life. So please take Dr. Taylor's advice to heart for your own personal health and share this seminar experience with others. Send an email to your personal address book, to your community internet forums, and to chats to tell them of this unique opportunity. You could be the cause of a lot of health going on out there. My second request is for you to consider buying Dr. Taylor's book, Are Your Hormones Making You Sick? You can find his link to his book on the left side under his picture on the audio page of his lecture. From the quality of what Dr. Taylor mentioned on today's interview, you know that you are in store for some important reading. By the way, I don't get a commission, and Dr. Taylor never asked me to mention his book. I feel my job is to bring to you the best of what's out there. Thank you for allowing me that privilege. The information given during this audio interview, and which is on this website that you viewed during the BHRT World Summit, is not intended to replace a one-on-one relationship with a qualified healthcare professional and is not intended as medical advice. It is intended as a sharing of knowledge and information from the research and experience of the practitioners in the field. I encourage you to partner with your own qualified healthcare provider to make the appropriate decisions for your individual best health. Please also visit the two political action sites listed on the BHRT Summit webpage to voice your concerns to your legislature about the FDA's ban of your being able to access estriol after all of these years that your physician has been safely prescribing it. Thanks for listening. It's quality of health for yourselves and for your family.